The single largest unmet need in treating multiple sclerosis at this point, which is the last quarter of 2016, is treatment of progressive disease. We have over a dozen therapies for treating relapsing forms of multiple sclerosis, and we've been very successful at doing that, having therapies since 1993. At the present time, there's no approved therapy for treating progressive disease. We've got lots of clinical trials, which we could talk about, but that's our largest unmet need. Treating progressive MS has been more difficult because we don't have a clear understanding of what's driving progression in MS. We have a pretty good understanding that relapsing forms of MS are inflammation, periodic flare-ups of the inflammation, and by suppressing that inflammation, we can suppress those flare-ups and have a very good outcome. In progressive disease, it's unclear what role is being played by inflammation, although we have a pretty good idea inflammation is a part of the disease process, but also what part is due to underlying neurodegeneration. And so the treatment strategies that are being employed, tested, are things, A, turning off the inflammation, more long-term in progressive patients, but also attempts at trying to treat the underlying degenerative aspect of the disease. But it's more complicated, it's harder to measure changes in progressive patients than it is in, say, relapsing patients. The biggest challenge of developing drugs for treating progressive MS relates to, again, our lack of a full understanding of the underlying pathophysiologic process. The other problem is that progression tends to occur rather slowly, and so it takes longer to do the clinical trials. We can get a proof of concept answer for an anti-inflammatory agent for treating relapsing MS in a 6-month study. We don't have the same sort of confident proof of principle metric for looking at progressive MS. We're trying to employ brain volume or subsets of brain volume, but even there, it's almost surely going to take longer than 6 months, hopefully a year, but it's unclear. And then when you get into the pivotal type trials where you want to really provide good evidence that a drug works with a clinical outcome, 2 years had been our standard in relapsing forms of MS. That may not be long enough in progressive forms of MS. So we're looking at alternative treatment designs, such as longer designs going out through 3 years, or event-driven designs, whereas you do the study as long as it takes to have X number of events, which is the number that you hope will be able to define a treatment success. The approach that's being taken for trying to treat progressive disease is several layered. One is there are studies going on looking at anti-inflammatory agents, and we've had some successes and some failures. We learned from each. So we had a study that looked at fingolimod, an S1P1 receptor modulator, which worked very well in relapsing disease, looked at it in primary progressive MS, and it didn't work. And it was a very good study, and so we learn a lot from negative studies as well. We have more recently a study of ocrelizumab, a B-cell inhibiting monoclonal antibody that has reported out at meetings successful outcome. We're waiting for the publication of the paper, but it's in the hands of the FDA to see if they're convinced that there's enough data to approve it for use in progressive multiple sclerosis. It was tested in primary progressive MS. We have another study that has just been reported out at a meeting, not yet published, looking at an S1P1, so next generation of fingolimod, a drug called siponimod, that again reported out modest but positive results in treatment of secondary progressive MS. On the other hand, we had a negative study with an anti-inflammatory agent looking at natalizumab, highly successful agent for treating relapsing MS, didn't work for treating secondary progressive MS. So from that, we're getting some clues as to who might be the right population of progressive individuals to treat with anti-inflammatory agents. At the same time, other agents are being explored. For example, neuroprotective type agents are being looked at, early phase studies to see if they can have an effect on progressive MS.